As you're lying here, we do your front and your back in sequence, and we go head to toe, as I've said. I usually check your head skin or scalp skin last when you're sitting up. Everybody's different in how we conducted the actual examination. This will help me look at what's there on the skin a little bit better than the naked eye. And once I'm convinced that there's something there that I should be looking at more closely, I then go ahead and use this instrument. This instrument is called a dermatoscope. Now, there are many versions of this type of instrument. Traditionally, this instrument started off as just a handheld instrument back in the 1600s, you can imagine. And they were just putting it to the eye, going in and having a look at your skin very directly and very intimately, very close to your skin.